my master's degree last year, October, and I've been thinking if I want to do PhD. Good to meet all of you, hearing from all of you. That also kind of clears my mind on where I want to go. Um, this comes communication influence on nutrition seeking behavior among young mothers. Many times we are speaking about how to eat healthy food. We are speaking about how we need our children to be healthy. We need nutritious food, but nobody is really going to the ground to find out the situation of these young mothers that we're taking to eat healthy. For example, this is a mom with her consent that I used this photo. She's 21 years old with 4 children. And it pains me that, well, my study, I really wanted to focus on the young mothers 15 to 20, but then again, the breaching data protection of those children who are minors and so on. So I couldn't do that. I had to do from 18 to 35. So, and I don't need to go through the agenda so we can save time. So so we all know that maternal nutrition is a critical public health issue, especially in informal settlements. And when I talk about informal settlements, those from Kenya or those in your countries where you have slums, I'm sure you relate. Young mothers, they face socioeconomic, cultural barriers to proper nutrition because, money is a problem in our countries. We also explored the communication strategies that Pumwani Hospital uses, because Pumwani is like one of the biggest maternity hospitals we have in Kenya. And so they've been trying very hard to reach these mothers by sending prompts or reminding them when they need to go for these consultations. And so some of the things I wanted to try to relate my study is observative nutrition seeking behaviors. For example, peer influence, and we have social media. Funny enough, someone will not afford a good meal, but they will afford data. I don't know how that works. Yeah, preference for easily accessible foods by young mothers, They opt for affordable chips here, 50 bob. Sorry, now I'm switching to Swahili. You want to pick githeri is the mixture of beans and maize, yeah? And then inconsistent clinic visits. Some mothers will seek nutrition advice when a child falls sick. And then in the context of public health institution, health centers do try to do door-to-door visits, posters, etc., but not everybody will really care to follow through. We are now talking about food fortification, provision of supplements by the public administrators, but how many people can afford the integration of digital communication, AI? We know like the reach on the SMS is big, but we have now again moved another step further with AI, digital health communication. We have drones that are sending medicines to people maybe in the very, very marginalized communities. So my idea is where we can come together and try to see that these young mothers change their perspective and start, seeking this nutrition information from public, from public hospitals, from their peers, from their mothers, from, people that they are relating with. So there is such background, again, quickly, not diving into, is the poor maternal nutrition that contributes to low birth weight. If you go to UNICEF data, you will see the numbers are huge. And what pains me the most is the little shaking that we've received from Trump administration, and children are dying. In Ethiopia alone, I think we have over 5 million wasted children, and that to think that our government can panic because of that is really sad. What do we do? We were saying we want the Africa we want. What do we do so that we're able to bridge the gap when this comes to us? Yeah. And so there's also, we have existing health communication approaches, but then they fail to reach the vulnerable population. And then I use the health belief model that provides a framework to understand how communication affects health behaviors. Then we have the problem statement. I'll just quickly run through challenges in the informal settlements: low literacy, economical constraint, cultural, social norms, limited access to healthcare. Pumwani Maternity Hospital, one of our biggest, one of our best. Of course, not the best of the best, but at least trying. And then the existing research gaps, limited studies exploring how mothers perceive or respond to maternal nutrition communication strategies. And then the study objectives were to examine young mothers' perception of the available communication strategies. You identify the key enablers and barriers to effective communication and provide recommendations for improving maternal nutrition programs. And then, so this is really just the theoretical framework. Sort of the health belief model tries to explain why I picked it, because it has a number of contracts that shows the perceived susceptibility, severity, benefits, the barriers. How can we take action? What is the self-efficacy of this? These actions that we want to take. So moving on, and then the research methodology, I picked qualitative study because it's exploratory and descriptive in nature, and also the fact that I could have one-on-one to really understand what these mothers are going through, to understand the motivation behind even wanting to do nutrition uptake. And then there was the population sample data analysis and ethical approval from the AIRB and ACOTSI. Those are the bodies in Kenya. And then why did I use qualitative method? I think I've already explained. It captures lived experiences, because through the focus group discussions and the interviews, you're getting to hear from the people that are affected. And then the flexibility of the in-depth interviews, because you're asking open-ended questions, and I allow the mothers to really explain their experiences and their barriers and the influence, social, culture influence. You know, in Kenya, where I come from, culture is very key. Someone will tell you peas are vitamins, and there's nothing you can do about it, even if you come with a theory. They've eaten potatoes and cabbage and peas. That is a balanced diet. So how do we change that mindset? And then social influence, actionable insights to provide practical recommendations for improving maternal health communication. Key research findings, of course, the hospital tries very much to have visual aids and images that are enhancing understanding for the low literate group. Personalized counseling, they are now moving to personalized counseling, where mothers come for counseling as they come for the prenatal care, postnatal care. Social support networks through families, just trying to involve the family, the husband, the mothers, who are also key decision makers in the family wheel. And then creating awareness campaign. What I liked, and I actually experienced the third day that I went for data collection, is they have these people with microphone and vehicles moving all around and telling them, immunize your child, come to the hospital for, for nutrition counseling, come and have your baby weighed. I think that's important, because as much as we were speaking about technology, that is actually what creates impact, and it is what reminds them that as much as you have to go attend to your daily duties, you have a child to take care of, you have a pregnant mother to take care of. And so the barriers, again, economic constraint is major in my country. Low literacy, we are assuming everyone is at par with AI tech, but it's not the case. Cultural norms, of course, the northern Kenya, we all know, not even northern Kenya, even near home, where you actually think people are probably eating healthy, they're not circumcising children, they're not believing in early marriage. These things are happening close home after how many years of campaigns, and we haven't really gone far. And then the discussions and implication, of course, more visual aids, because this is what they have accessible to. I think personalized counseling is really key. If hospitals and governments can really fund this project, is really good for these young mothers. And of course, bringing the family social support networks into play. Economic support initiative, food subsidies. We are talking about, if you go to the UN development world now, it's about fast food. For me, when I heard that word, I thought it's chips and chicken, but it's actually the fast foods that you give the baby the first 6 months. So we are talking about food security, there is the climate change, all things are into play. I hope I'm not out of time. Recommendations, policy, intervention by the government, of course. Our governments, we need to drum to their ears. We cannot depend on aid forever. We need to pick up and act. Health communication strategies improve. I think this is you now. Steer the tech forward and let people receive information where they are. It doesn't matter if it's the other side or the whatever. Healthcare training and support, and then who's starting their PhD, comparative studies to communication. Very easy topic. So effective communication is really essential in improving maternal nutrition. We need tailored strategies. Okay, I will speak about, I will talk about it earlier, because we need to see the transition. We don't want to be here at speaking. We really want to see behavior change. We really want to see people taking all these studies we have done. Imagine how much research we have done. We need action now. And then addressing economic and cultural barriers. The government needs to create jobs for its people. And then future research, digital. Okay, there you go. Now, 2 topics now. And yeah, thank you.
Wow, isn't it amazing that after taking a flight, 12 hours to New York and back to Indiana, she's made a very good presentation. I mean, let's clap for her. Right, so we have 1 or 2 questions, and the other model is that you can always write your question on the back of any of those papers and give the presenter. Elizabeth, I know you had a question to him, so you can just write and give it to him and you can talk. But let's have 1 or 2 questions to Mercy. I'm sure she's very curious for your feedback. Yes, go ahead.
Yeah, thank you so much, Mercy, for a wonderful presentation.
Thank you.
Actually, it's exciting to know how things are going back from there. So I know my name is Charles Kondo. I'm pursuing a PhD in epidemiology here at USIU. I wanted to ask, in your problem statement section, you mentioned the problem among young mothers, but I was not able to see the numbers in terms of the budget compared to other groups, like we also have pregnant mothers, right?
Yeah.
Pregnant women, we have children under 5 years old. We needed to have maybe something that shows that actually it's really a problem among young mothers and not and be a higher budget compared to pregnant women or children of 5. Just for to show that it's actually a problem. Because you did mention socioeconomic barriers, but then giving us also numbers to make maybe more the conversation more meaningful to the audience.
Oh yeah,
so
sorry about that.
Just to improve on it.
Yeah.
And
Okay,
then finally, on your conclusion, you did also mention future studies should focus on digital intervention and how it's gonna influence the health outcomes in the future.
Yeah.
Being that I'm here, we can work with you on that and further that kind of research.
Absolutely. So maybe that's my PhD research area. So on numbers, I didn't want to bring everything from the manuscript to the presentation, but the numbers are there. I may not have them on my fingertips, but if you go to UNICEF WHO website, we have the number of wasted children or the number of under 5 that have malnutrition issues. But I can also be able to give you before we leave. It's only that I don't have them like I can. And I want to give you actual figures for Kenya, and I don't want to reference another country. Yeah.
Wonderful.
I
Yes.
have 2 questions. One, I'm not a medic, so I don't understand. What do you mean by wasted children? Secondly, you talked about cultural practices affecting nutrition. And then under that, you talked about northern Kenya, and you touched on something to do with circumcision. So I'm just curious. You talked about children being circumcised. How does it affect nutrition?
No. Okay, so let's start from your first question where you said wasted. So before you used to say that children that have malnutrition have stunted growth. But now with the UN, the whole body that deals with this health matters, they've changed that into wasting, meaning that the child has severe malnutrition, like you're wasted. I think it's probably a better word to use, I don't know, but they're now calling it wasting. They are not calling it stunt.